Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary for athletes and active people on all sorts of injuries and injury treatments and injury prevention so that you can stay healthy and perform your best, whatever sport or exercise it is that you like to do. Now, I see as an orthopedic surgeon and again, sports medicine doctor, I see basically two types of injuries, or two overall categories of injuries. There's traumatic injuries and overuse injuries. Traumatic injuries are basically some specific event happens. You know, a football player has somebody take out his knee trying to tackle him. Somebody trips and falls and lands on their hand and hurt their shoulder, that kind of thing. And then there's overuse injuries that are due to a repetitive motion over and over again. Literally yesterday in clinic, my last two patients of the day, one had a traumatic injury and one had an overuse injury. I had a guy, maybe late 30s, early 40s, very active, likes to lift weights. He was changing a smoke detector battery and was on a ladder, and somehow he stumbled and fell off and he hurt his ankle. We probably can't prevent all traumatic injuries because they're not due to some correctable problem. But my other last patient, I think she was my last patient, high school volleyball player, has a full college scholarship that she'll start when she goes to college to play volleyball. But she's been dealing now with this pain in her foot for about 4 months. No specific event, but noticed that she was having more and more pain as she was jumping. And at first it was just sort of nagging, but it got to where it was really bothering her. And then it was starting to bother her with her daily activities. Now she's really worried that she may not be, she's got to get it healed in order to play in college. She didn't want to lose her college scholarship. That's an overuse problem. And I want to talk about overuse injuries in this video because we probably can't prevent most of the traumatic injuries, but the repetitive motions that we do in all sorts of sports and all sorts of exercise are potentially fixable. It could be a repetitive tennis serve. It could be the twisting motion with golf swings over and over again. It could be repetitive jumping for basketball or soccer. There's so many repetitive motions, and those motions put microscopic stresses on whatever part of the body it is that it affects. And those microscopic stresses aren't really enough to cause an injury by themselves. But if you don't give your body enough time to recover, those stresses can build up and actually can cause an injury. And it can be all kinds of injuries. If it's a bone, it could be a stress fracture or an inflammation of a tendon, a tendonitis, or all sorts of other musculoskeletal injuries. So I have a couple of tips to share about ways that potentially you might avoid some of these repetitive overuse injuries. The first thing I'd suggest is fix your technique. Again, I talked about the repetitive motions put these microscopic stresses on your shoulder or on your knee or ankle or foot. And in and of themselves, potentially those aren't harmful. But if you just flail your arms around or do something with a technique that's not perfect, you're gonna put that stress really where it shouldn't be. Then those microscopic stresses can be much more serious and cause serious injuries. So if you have bad form with your tennis serve or with your golf swing or whatever it is, work with a coach, work with a trainer to fix your technique and prevent some of those stresses from going to the wrong places and causing injury. Now, another thing is, I think it's really important to give your body enough time to rest. Again, those stresses are going to just one or two parts of the body. And if you do it all the time, that's going to build up. Your body doesn't have time to rest. So, say for instance, you love to run. Maybe you run 5 days a week, but the other 2 days a week, you can still get exercise, but do things that focus the stress on the arms or your upper body, like lifting weights or swimming. But you're still getting exercise, but you're limiting the stress to your legs. Try not to put the same stresses on the same parts of your body over and over, day after day. That's one of the whole points of cross-training. Plus, in addition to spreading the stresses around and giving your body, especially the affected body parts, time to rest, but adding in new things may actually make you a better athlete by helping you develop skills that your main activity doesn't really encourage and doesn't really develop. So it can actually make you a better athlete too. The last thing I'd say is if you start to develop pain, it comes on over time, there wasn't really a specific event, and it could be due to a repetitive motion, take a few days off. Give your body a little bit of time to rest. You know, if it was due to overuse, usually a few days of rest and avoiding that activity, or even maybe not complete rest, but modifying and avoiding the things that cause you to hurt, that few days of off, that few days of rest or activity modification may be enough to get it better. Now, if you go back into your activity and it hurts right away and it comes right back, maybe you should think about seeing a doctor. Find out what the problem is. Maybe take some simple steps to get over it before you cause a more serious injury. Okay, what do you think about those tips? Have you suffered an overuse injury? You know, injury while you're training for a marathon or half marathon, or some sort of nagging elbow or shoulder pain from some new weightlifting program? I'd love to hear your experience, and maybe you have advice for other people on not just preventing these problems, but treating overuse problems as well. Below this video, leave your comments, leave your experience and your advice. I'd love to read it, and I'd love to hear what you would suggest for other people. If you know people dealing with an overuse injury, or maybe they're trying to start a new program or training regimen to train for some big event or competition, share this video with them. Maybe this information can help them avoid an injury as well. If you like videos like this and want more information and education on sports and exercise injuries and injury prevention and injury treatments, subscribe to my video channel. I record a couple of these videos every single week, and they'll get delivered directly to you. And last, there's a number of resources that I only share by email, and these are terrific resources, completely free, on ways to stay healthy and perform your best, whatever your sport or exercise. So go to my website, drdavidgeyer.com, enter your name and your email list, and I'll get those to you on a fairly regular basis, and again, completely free. I think you'll really like them. Thank you so much for joining. Again, I'd love to hear your experience and your advice on some of these overuse injuries in sports medicine, and I look forward to seeing you right here next time.